Okay, everybody. Today, I'm going to share with you how to re-enter a patient if they have had a revision of their prior operation. So, to be specific, this would be somebody that you did a ventral inguinal hiatal hernia. A year or two later, their hernia recurs, and then you want to reoperate and fix it. So, there's a few steps to do this. And in a couple minutes, you can get yourself back where you can start with a new operation afresh, as well as the PROs to start with that hernia that you're doing. So the first thing that you're going to want to do is you're going to want to be in the all registries patient section. And this will just be a test patient of a ventral hernia. Just for ease of sake, I'd say I did this a couple days ago or a year ago, whatever. You're going to get here, all the data is going to be here. And over here on the right side, you're going to see this area, this little person that's grayed out. It says withdraw patient from surgery. So you're going to click on this and it's going to give you a choice to either remove them, which you do not want to do, because if you do that, all of the old data from their old operation and their old patient reported outcomes is going to be removed from the registry. What you want to do is withdraw them. That will hold all their old data, save it for us, and then allow us to then start afresh with a new patient. And I'll show you how to restart that process. So again, we're going to withdraw them. You can answer why. This will be for a revision. Do not click re-enroll. That will cause some issues. Just revision, and then you're going to confirm the selection. And now you'll see that this is grayed out here, or sorry, yellowed out, which means that the patient has been withdrawn. So now we're going to want to go back and we're going to search for this patient that has been withdrawn, and you'll see that they will now show up. And again, you're back to that normal view. Don't forget that step that you have to go back and search for them again, because now we're going to take care of this. They are withdrawn here. We are going to add the patient back to the registry now. And when we do, oh, I'm sorry. First thing we want to do, I take that back. Let me just do this real quick. That was wrong. We're not going to do it that way. We're going to click on this patient, okay? And instead of doing, once we do that up there, we're going to add the selected patient, okay? So we find the patient. By the way, it says right here that this W means that they've been withdrawn, and you're going to add the selected patient back. And now this is going to take us to what we care about. So the date of the procedure will be today. It will be for a revision. Importantly, and this is a little bit confusing, this terminology, so just pay careful attention. The date of revision procedure, that means the original procedure that you did, but everything is being driven off this top one. So we'll just say that this one was from a few days ago. This is our second revision. The reason is for a recurrent hernia. And then you'll want to put the CPT code in again, because this is what's driving all the PROs. Then we're going to add this patient. And then we can just click over to the enrollment questions. And this will allow us to go, I have my pre-filled results. I say I did an open TAR in this patient. It takes me to everything pre-filled, and that basically completes it. And then the whole process starts over, including the timing of everything. So that's it. That's all it takes to add a patient if they've had a revision, and then you can go ahead and move forward. I should say that now both patients will show up. Let me just show you real quick. If we search here for our patients and I put in ventral, you will see that both patients now will show up. So it is important. I just take you all back to, you can look at the date of the procedure. This was the original procedure. This is the revision. You can tell this patient has been withdrawn and this patient is the current patient. And then you'll have all the opportunity to fill out all these forms as we have done in the past. And that's it. That's what it takes. And certainly let me know if you have any questions.